first, pitocin later. It really just depends on the provider like realize a lot of people like provider may I don't know a ton about the NIP test. Hello, Facebook. Welcome. So glad you guys are here. Thoughts on raspberry leaf tea and dates. So raspberry leaf tea, as far as the studies show, is not helpful. Dates, if you start like a month before and you're eating like 6 dates a day, they have shown that it decreases your chance of needing an induction, but doesn't show that it's going to put you into labor, if that makes sense. So maybe does something to soften your cervix, stuff like that. Hello, Facebook et al. Ask us questions in the comments. My birth plan has fully bulb first and then low and slow pit. So Avery, interesting. I am wondering why you wouldn't want to have a misoprostol, Cervidil, or Prostin gel, possibly in addition to the Foley bulb, or yeah, huge fan of misoprostol. Gets a lot of hate online. I think because it is used in conjunction with abortion sometimes, but that's not what we're using for in birth. There's a lot in birth that are used in conjunction with abortion, so we can't just write off everything. Did the membrane sweep help induce you for all of your babies? First one, no. I don't remember too much with that one. Second one, I thought it did. So I got a membrane sweep, went for lunch at the Cheesecake Factory, had a boatload of chocolate cake. Hello. And then the third one, no. I went 12 days over with her. Wouldn't recommend it. 0 stars. I had Cervidil with my first induction and it caused late decels and ended up having an emergency cesarean. I mean, it's hard to say if that would have happened anyway, because late decels mean a decrease like blood oxygenation to the baby. So I don't know. I'm usually a huge fan of that. But Avery, if you've already had a C-section, you can't have misoprostol. I don't know about Cervidil. It depends on the hospital's policies. Is the membrane sweep okay if you're going for a VBAC? I believe so. If they're planning on a vaginal birth, you can have a membrane sweep. 35 weeks and have 2 placentas. No issue with vitals. Do you think I will go to 40 weeks? I don't know that I've seen a patient with 2 placentas. I've seen 2 lobed placentas. I always plan on going to 40 weeks or longer. And then if you have your baby early, you'll be happy. I was just saying earlier, I have a post that I did this week to the mom who thinks she's going to go early, because I hear that all the time. I hear it all the time in my lives, on my page. My doctor thinks I'm going to go early. And then I'm like, why? And they're like, well, you checked my cervix and I'm 1. And I'm like, that's amazing, but that isn't any indicator that you're going to go in early. So I think it's so important to just think, probably going to my due date, because that's how things happen. Of course, if you want to have an elective induction at 39 weeks, that's up to you. But yeah, always just plan on going to your due date and even past your due date. If I got pregnant again, I would just think, okay, I'm going to have it by the end of the month, whatever my month is. If I'm supposed to be due in April, I'll have it by the end of April, right? Yeah. Oh, twins early on, but one has stayed and kept growing. Interesting. Misoprostol contraindicated yet for previous C-section patients? It is, yeah. So Avery, that was a dumb question to ask, but I didn't realize you'd have a previous C-section, because once you put in the misoprostol, you can't take it back. Whereas Pitocin, like the half-life in your body is very short. So we can run low-dose Pitocin, which was on your birth plan. That being said, orders for medication really aren't awesome to have on your birth plan, because all that comes from the provider. So that's something to talk with your provider about what's going to happen. But like the nurse isn't going to follow that, because she has to follow whatever your doctor orders. Yeah. Local Elise, Facebook, ask the questions. My baby is not head down. I'm 35 weeks. Any chance baby will flip? There is a chance. The further you get into pregnancy, the less likely it is. Do we like my water bottle today? What is different medication I can ask? Oh, about your baby flipping. A lot of my friends have had good luck with a chiropractor, but the earlier you start, the better. I am a fan of versions. Depends on how well your doctor does them, because I feel like it really varies. Yeah. Avery, you're so welcome. I would recommend taking a prenatal class, especially. So I have 2 levels of my prenatal class. So the one is 89 plus use coupon code Lucky Day for 10% off. So that brings it to like 80. Um, it's great for second time moms, people who just kind of need a refresh. The bundle class is great for first time moms, anybody who wants a little bit more about like baby care, breastfeeding, stuff like that. So you can get like all of it in one place: nutrition, breastfeeding, baby care, baby sleep, all in that bundle. Or you can get just kind of the basics in the $89 class. So, and I recommend it for everybody, but especially people who are having an induction, VBAC, anything like that. Any issues with pregnancy, I especially recommend it. Let's see. Funneling at 20 weeks, so that means your cervix kind of goes like this. Is progesterone strong enough for me to reach viability? I do not know. I don't know about that one. We don't deal with progesterone much in the hospital, so. What is a different medication I can ask for besides Pitocin? So usually Pitocin is what takes you to delivery. Misoprostol, Prostangel, Cervidil will get you going to about 3 centimeters, and then Pitocin takes over and runs you the rest of the way. The first ones are just to ripen your cervix, those early parts of labor. They're not meant, they in general don't take you all the way. Now, that doesn't mean I haven't had patients who I gave a dose of Cervidil to, and then they were in labor, rip roar in labor, and ended up having their baby. That does happen, but it is more rare. So if you are being induced, you need to plan that Pitocin is going to be part of that induction. Because there really isn't anything else that you can give. There are things you can give early on, breaking your water, seeing if that just starts things, but it doesn't always work like that. We have a lull in questions. So I was talking about how when that medicine hurts Pitocin. Well, labor hurts. So Pitocin puts you into labor. I have had induced labor and I've had non-induced labor, and I honestly feel that they feel very similar, except for being extremely bored in the hospital. So it's hard to say. Yeah, and studies actually show, I don't know how they study this, that people don't actually rate induced labor any more painful than non-induced, even though you'll see on the internet all the time everyone saying that it hurts a lot more. Take that for what it's worth. My first baby, I went totally on my own. Second one, I was augmented a little bit, I believe. I don't know why I came in labor, but the hospitals are weird. That's something you can totally say, no, I'm not interested in it, right? And then the third one, fully induced. I'm 30 weeks with my 7th baby. Doctor said this baby might come a bit early. Again, doctors say stuff like that, and I don't know why. Obviously, it's your 7th baby, so there's a good chance, but I have friends who, 8th baby still go over. Like, how mean is that of your body? But just because it's your 7th baby doesn't really mean that you're likely to, go any earlier. Some doctors saying babies staying in birth canal for a long time can cause some neurological issues. It can, so we have to be mindful of that. May I decline an induction if everything else is stable? Absolutely. You can decline anything in the hospital. You just need to understand why they're recommending it, because it is your doctor's job to make recommendations like that. And then if you feel like, no, I'm good without it, then you can decline it. And the good news is you can always change your mind. So, one day you're not feeling it. The next day you're like, no, I think we should probably get her out. You can call your provider and see what they can do. If you start labor and your hospital is 2 hours away, when should you head to the hospital? Oh, Che, that is a tough one. I would talk with your provider about what they recommend. Yeah, because they might have a good idea of what to do. I do have a post on the pregnancy nurse about what to consider about going to the hospital when you're in labor, but 2 hours away, that's tricky. Yeah. I went to get checked because I had so much pressure when I walked. They checked me and I was 1 centimeter. Yeah, so 1 centimeter. Some people may never, if it's your second baby, your cervix may never have closed. So not unusual. It still doesn't mean that you're going to go early. It just means your cervix is opening up a little bit. And I know that's frustrating because when we think, oh, something's happening, maybe we're going into labor. That's normal to think that kind of thing, but that's not always true. So All right. Keep asking questions, you guys. So, um, how long after your water breaks? Like when you're in labor? Everybody's different. There's no way to know. I've been sick for 4 weeks now. I think I have bronchitis, I have a horrible cough. What do I do? Talk with your provider. They might want to give you some bronchodilators, some antibiotics, things like that. What is the very first sign of labor? I'm 36 weeks with my first, and I have 0 signs. Man, it really just depends. So I would recommend it. Labor is not just contractions. So usually when I find that you're in actual labor, there's more signs than just contractions. So I recommend taking my prenatal class where we go through all of the signs that you can watch for. You can also go to the pregnancy nurse under resources and click on that, and there's a labor sign checklist that you can look for, but everybody's different as far as like what's the first sign that they've seen. Facebook, YouTube, where are all your questions? Or Instagram, I guess. What is a good reason to have an NST? It just any issues with the baby, overdue, things like that. Do you ever do virtual support asking for myself? Like hospital for support for somebody in labor. I do not. Um, I just don't know how helpful it is. My big goal is to get you ready to ask the questions and be confident in asking the questions so you don't need somebody there when you're in labor. And most, the people in my class have found that just taking the class is usually enough that they can feel confident in asking their own questions when they get there and talking with their doctor previous to it, because I talk a lot about what you can ask at your prenatal checkups and stuff like that. What is your experience with unmedicated labors in the hospital? It's been really positive. I know it sort of depends on how much your hospital does, but where I started, we probably only had 25% that got epidurals. And so I was very used to handling patients that were going natural and helping them, and things like that. So it kind of depends on where you're delivering. It's never a bad idea to go on a hospital tour and ask them, how often do you see natural deliveries and things like that. Something about a pregnancy test, that is not my skill set. Avery said she has trouble being an advocate for herself and it's something she needs to work on. Yes, I think a lot of people feel that way. In my prenatal class, I have a whole provider communication video in the bundle. I constantly am like showing you how to talk with providers or what to talk with providers about so that you feel confident in asking those questions, because nobody wants to feel mean or like they're not using their providers adequately, but they also want to make decisions for themselves. And so I'm always talking about how you can do that in my prenatal class. So Avery, I would totally recommend that you come join me in there. What is your thoughts on heavy spotting during ovulation? I don't know. I don't have any thoughts on it. I don't know much about getting pregnant or like staying pregnant those first few weeks. So I'm just going to skip questions about those two because it's just not my skill set. Which it should be. I am the pregnancy nurse, but it's really like second trimester on pregnancy nurse. User said I had a C-section due to a small pelvic bone, I guess. Baby wouldn't budge after 3 hours. So it could be your pelvis bone. It could be how baby was in there. Sometimes baby do something that we call asynclitic, where their head just kind of gets in a funny way, and then their uterus is kind of slamming down, and so they're just going this way, and so that's why you might end up having a C-section. In those cases, I think it's okay to try for a vaginal delivery, but you need to be aware that it could be your pelvis, or it could have been how the baby was was like placed in your womb. So I recommend lots of movement if you go to try it again, and just see how it goes. Be open to the fact that you may end up having a C-section the next time, and that's okay too. Somebody had a specific question about theirs I can't answer anything too specific. Somebody had both shoulders get stuck. If you had a shoulder dystocia last time, it wouldn't be unusual for them to recommend another one. Is it normal to feel fullness in abdomen when bending down one side only 19 weeks? Yeah, just because your abdomen is definitely getting full, so it just gets like that. Of course, user. User. That sounds like a weird way to say it, but I definitely wasn't going to say all the numbers. Kay said, tried Zofran, ginger ale, and lemons. I'm so nauseated. Nothing will stay down. Any advice? Talk with your provider. There are things that your provider can give you for morning sickness. I can't recommend any of those things here on the internet, but there are things they can do. I bet even if you call the office, they'll have some things that they can recommend for you to take because medications can help. Although you said you tried Zofran. Yeah. And if the problem, here's the problem with morning sickness is the longer you stay dehydrated, the more you are to vomit. And then it's just like cyclical to where um, you're dehydrated, so you vomit, and then you're dehydrated, so you vomit more. So sometimes going in to just get like an IV can be extremely helpful. You're going to feel like a brand new person and kind of start over. It's like a reset button. Morgan, do you know if castor oil actually puts you into labor? There are some studies that show that it does, but I do not recommend it. It can cause you and the baby lots of stress. If you look over on my site, I have type in midwives brew. I talk about it on there. Chase said she's a first-time mom with lots of questions. That's what I'm here for. Come join me in the online prenatal class for couples. It is the easy way to get prepared for birth. I would love to see you guys in there. You can find it through the link in my profile all the time. Yeah, or at onlineprenatalclass.com. Kay asked, so even if she can't eat, just drink? Yes. So anything you can keep down is a big win at that point, Kay. So try and get some calories in the things you're drinking. Usually water doesn't stay down as well as like ginger ale or Sprite or Gatorade. And those things have some sugar in it also. So that can be really helpful. All right, a little lull in our questions. If you guys have any more, let me go ahead and put them in the comments. How's everybody's day? Is it starting to warm up where you are? It is warming up here. We're almost to 100 degrees. Hello, Phoenix. Haley said, hi, Hillary. My 24-hour protein was 548. Normal labs being bile acids just spiked to 9. What about your liver enzymes and platelets? So, yeah, I mean, it sounds like you might be headed to some preeclampsia. I don't know the normal bile acids number. I just go by if it, yeah. Shay says, curious to know a little bit more about your prenatal class and what it entails. Great question, Shay. Thanks for asking it. So it includes videos, text, questions for you and your partner, and with a partner, although it doesn't have to be taken with a partner. It has like quizzes to make sure that you're getting the right information. So it has 13 lessons. And it goes over everything from like pregnancy, like third trimester testing, all the way up until your first few months postpartum. So if you have anything specific about it, let me know. But people love it. If you read the reviews on there, so many good reviews. We have over 100 positive reviews that you can read. And I actually guarantee that you're going to like it. If you get in it and you absolutely hate it, email me. We will give you your money back. I'm having terrible back pain, 33, almost 43 weeks. Can't get comfortable there. Yeah, talk with your provider. It's not light heat. Like try and not do things that aggravate it. And maybe a maternity belt might help you out. Haley, it sounds like you're getting induced soon, though, so I wouldn't be too nervous. Just hopefully keep doing your kick counts and things like that. Shay asked, I'm interested in having an unmedicated birth. Will this prep me for that as well? Yes, so we are going to talk about the pain management options, but I have a whole natural pain management video that's included with both of my class levels, where I talk about things you can do, breathing, ways to cope both at home and in the hospital, and ways that your partner can help you out. So it's super helpful for all of that. It's not a birth class that's just angled toward like if you're having a natural birth, because a lot of people might think they're going to get an epidural and then end up having a natural birth. So I think it's really important for you to be prepared for a C-section, a natural, a medicated birth, just so you know all of your options. And when you get in there, you're not like freaking out about it. I know some nurses tailor it just to natural, but as a labor nurse for 20 years, I don't think that's your best option. So that's why I did it my way. Jawar said, I'm 30 weeks pregnant. I'm so exhausted. I can't do anything. Sounds so normal. So just make small goals. Try and get stuff done and make sure that you're staying dehydrated and you're eating the right foods because that will help you feel so much better. Unique 36 weeks and tummy is smaller and lower today with not as much movement. Should I be worried? If your baby's movements have decreased, I always recommend going to the hospital, but I also recommend going to the hospital for or doing your fetal kick counts. And if you don't know what those are, you can find on my site through my link in my profile, you can find a free kick count cheat sheet that'll show you how to do kick counts. Megan said, how many sonograms should we be getting? Usually the routine ones that they recommend is one early in pregnancy to do size and date. So usually that's done like 8 to 13 weeks. And then one at the anatomy scan, so around 20 weeks. And usually those are the only two that are recommended. I know it can be troublesome because some providers like provide them in the office or order them more frequently, but the FDA actually says that the least amount of ultrasounds the better because they're not exactly sure how they affect baby. So there's nothing wrong with not getting them as often, but I know that you're kind of like, I want to see my baby. Can I have a VBAC if I had my C-section a year ago? Talk with your provider. It really just depends. Can you have preeclampsia without high blood pressure? You can, but it's pretty rare. Also, usually the blood pressure goes up for you. So if you start super low and then it goes up like 20, then that can be a sign of preeclampsia, but it's kind of like from what your baseline was. Usually it does raise a little bit. My first baby was emergency C-section, now accepting second. How likely is it for a VBAC? It really depends on when the first was done. You should talk with your provider about it. I'm planning not doing an epidural this pregnancy since I'm due July. I had 5 epidurals with my babies. Yeah, give it a try. When can you get your first membrane sweep? Some doctors will do them at like 38 weeks, maybe 37, but they won't do them before then. And some won't do them until 39 weeks. Just depends. Talk with your provider about what they are recommending for you. Also, your cervix does have to be a little bit open in order for them to get in there to do the membrane sweep. If it's completely closed, they can't get in to do it. So there's that also. And a lot of people up until like 38 weeks, their cervix is usually pretty closed. Can scoliosis affect the epidural? It is really rare that somebody has a back problem that prevented them from getting the epidural, but honestly, I don't know. Talk with your provider. If they should know the basic answers, and if they don't, a lot of times they'll talk with an anesthesiologist at the hospital. I'll hear them talking before a C-section, just discussing a patient issue so that they know what to tell their patient. Or sometimes if it's like bigger, they can have the anesthesiologist give you a call so that you can explain what your issue is and they can explain what the issue might be at the hospital. So talk with your provider. Those are a couple options that I've seen. You can't really talk with the anesthesiologist that will be on when you have your baby, but they can just give you general ideas. Popping noises from your belly. If your water broke, you would have fluids most likely. But if you ever have a question, you can go in and be seen. I always recommend if you have a question, you think your water's broken, call your doctor's office because if they can test you in the office instead of the hospital, it's cheaper and so much easier because we have to go through all of the questions and it's not very fun. Have you heard of a VBAC after 2 C-sections? I sure have. As far as I know, there is not an increased risk for uterine rupture, which is the biggest issue that you would have after a previous C-section, even with your second. Now, if you get to 3 C-sections before vaginal delivery, then there is an increased risk as far as I know. But 2, you should still be good. Talk with your provider about what happened previously to see if it's right for you. Doctor said I'm anemic and on iron pills 2 times a day. Should I be worried for delivery blood loss? In some cases, yeah, you would be at a higher risk of possibly needing a blood transfusion. So talk with your provider. They should be talking about that with you in the office, I would think. Will I get a positive pregnancy May 10th? Heaven, who the heavens knows? I don't. Good luck to you though. What does it mean if I'm 1 centimeter dilated and 80% effaced? It means your cervix is opened up a little bit and it's thinned out. You got to think of it as like putting on a sweater, like a very tight neck sweater. And as you're pulling it over your head, you can imagine that it thins out and opens up. Same thing for your cervix. How do I prevent the blood pressure dropping after the epidural? So just be sure when you get your epidural to mention to your nurse that, I don't know if you've had it happen previously or whatever, but the nurse can make sure that she's giving you lots of fluids before you have the epidural. There's also medications that they can have standing by to pump back up the blood pressure right away. Yeah. So it's not unusual, but if you've had it happen in the past, it really helps your nurse to know that. So you're prepared. Does your second baby come faster? Usually those last few centimeters, centimeters 6 through 10 is quicker. And then also the pushing time is much less if you've had a previous vaginal delivery. Yep. Let's see. Anything else that I wanted to talk about today? I think we're out of questions. I'm unable to get to everybody's questions. I can't scroll back up and then go back down. So I'm sorry, guys, but if I missed your question, feel free to put it in the comments again. I have just a few more minutes that I'm going to hang out here. Then it's going to be time for dinner. Third baby after 18 years. Will baby come faster? So it's been 18 years since your last baby. I've heard some labor nurses say that after 8 years, it's like you're back to your first. I would disagree with that. Usually I've seen it still is faster, but yeah. I've been cramping a lot. Not sure if it's contractions. I'm due in 2 days. Do I go in on that day? So you go in when you're on labor. If you have questions, talk with your provider about when you should go into the hospital for sure. I'm 37, just found out I'm pregnant. Everyone's telling me I'm old. I mean, 37 isn't that old anymore. But there are some increased risks after you're 35. So it's just something to be aware of. But there are plenty of 37-year-old moms out there anymore. Morgan said, this is my second time getting induced. Awesome. I actually have just made an induction checklist. So if you go under free resources on my site, you're going to click on resources. Then on the top, it says free resources. Click that button. And there's a free induction checklist. So if you're thinking about getting induced, talking with your provider about it, it's some things to talk with your provider about before you go in so that you're not like surprised by how long it takes or other things during your labor. I think it's really important to do that so that you have a realistic idea. Because I think a lot of people think, yeah, I would love to be done being pregnant, but they aren't realizing that their labor is going to be long and boring, and that isn't very fun. So it just depends. I mean, if people are down to be in labor longer and more painful, then that's fine too. I am here for your 39-week induction needs, but I just want you to be prepared for it. So you can find that under resources. I think I'm getting something from Amazon right now, guys. Yeah. Yep. Looks like we have lots of other mamas that are in your same over 35 thing. After 6 births, I don't think babies come quicker. I would agree. My labors all got sort of like longer and more ugly. Not like ugly, but I was like, my uterus is just tired. What are your thoughts on getting Pitocin? I see a lot of people say that it hurts bad and I'm scared. Labor hurts. So you need to be prepared for labor. Does it hurt more than regular labor? It's hard to say. The studies don't show that to be true. Personally, I don't think that it hurt any different than regular labor, but everybody's different. Yeah. Are North bleeds normal in the 3rd trimester? I get them almost every day. I'm 37 weeks. Fitness G, talk with your provider. Sometimes just like your mucous membranes get dry in there, so you can try like a little bit of Vaseline in there to make sure that they're staying like moisturized. But they aren't unusual during pregnancy because of all the increased blood flow that you have in your body. Sometimes it makes you have nosebleeds. I just did a post on pullingcurls.com on pregnancy symptoms a lot of people miss, and nosebleeds is one of them in there because I was like my second baby, like I was just like charting. We used to paper chart. That's how old I am. And like just all of a sudden it was like a drop of blood on my paper charting. It was so embarrassing. Why do you get cold like chills? I'm not sick. I'm 11 weeks. I think your body is just having a hard time like adjusting to the baby and all the different things. I really think that that's what it is, Alex. You feel like all the blood rushes to your head before getting them. I'm not sure what them is. Do you know if a clear blue? I don't know. I don't know anything. I always used them from the dollar store, guys. Hillary was poor. Yeah. would you recommend getting Pitocin, or would you let the baby come on its own? It depends on what things are going on for you. I have friends who love getting a 39-week elective induction, and I have friends, and I personally didn't. I went 12 days overdue because I didn't want to have Pitocin. So I think you, again, should get that induction checklist, Leah, that is in my resources sheet. Grab that so you can talk with your provider. You can have a really clear idea of what to expect when you're in labor so that you can really make the choice that's right for you. That's what I would recommend. I would also recommend taking the online prenatal class for couples because it really will prepare you so that you're ready for an induction or whatever is going to go on. Something about a pregnancy test. We're skipping all those. Sorry, guys. I don't know too much about that. I was against Pitocin when I was 41 weeks, so I gave in because I was a VBAC. Yeah, I ended up having Pitocin. I was 12 days over, and my doctor was like, I really think you should be induced, and outlaid all the reasons. And I was like, yeah, that really does make sense. And so I ended up getting Pitocin. And it wasn't that bad. I wish that I had not made it as big of a deal in my head as I did, because that was fruitless time that I could have like had a nice frozen yogurt or something. I'm 33 weeks and the baby seems only to stay on the right side this week. Ultrasound shows baby is breech. Yeah. So 33 weeks, baby still has time. Hold on. My friend wants to pick up my daughter. And I'm never against somebody else picking up my daughter. Anybody else on that train? Well, because she's my friend. Sorry. Messaging the husband. Yeah, so if baby's breech, I have a post on the pregnancy nurse about getting baby to flip. But 33 weeks is still a little bit early to freak out about it, but I might consider going to a chiropractor because they have a lot of good luck. I've had my best luck, I think, with people trying, a chiropractor for getting baby to flip. Trying to get pregnant. I'm skipping those. Sorry, guys, not a lot of skills in the trying to get pregnant part. Yeah. Stacy said, I'll be 34 weeks tomorrow. I was diagnosed with gestational diabetes. I'm on insulin morning and night. I've changed my diet, but still struggling with my fasting numbers. Any tips and tricks I don't know about? Not so much, Stacy. I mean, there really isn't that much you can do about your fasting numbers. And so if that's the problem, they just kind of have to adjust your insulin. So I'm really sorry. Sometimes it's just tough. And there's not really that much you can do about it. You're not doing something wrong. Don't blame yourself for this. This is just the baby getting all those, your pancreas like out of whack. What is a chiropractor doing for the breech patient? That is a really good question. And I don't really understand it. I did have a chiropractor on my podcast once, and I don't know what they're doing, but I don't know what they're physically doing, but I know that they're adjusting your pelvis to hopefully give baby the room in order it needs to flip. So yeah, but also the idea of them helping my pelvis sounds pretty magical also, because my pelvis was pretty darn ornery by the time I went to go have my babies. I don't know if anyone else is in that boat, but yes. Lots of talk about baby dust and trying to get pregnant, which again, I can't wade into that one. What's the best way to get over nausea? Talk with your provider about medications. And like I was talking about earlier, sometimes it can really help to go in and get an IV and kind of get a reset so that you're hydrated and you can really try and fight it again. Fight it. I'm not really sure that's the right words, but yeah. All right. Any more questions? Just a quick reminder. I would love it if you guys came and joined me in the online prenatal class for couples. In just 3 hours, you can get prepared for your birth. And then if you would like to take the bundle class, you can also learn about nutrition, provider, communication tips, breastfeeding, baby sleep, baby care, partner tips, induction. I talk a lot about induction in the bundle. And I dive into the Arrive trial. If you're considering an elective induction, I have that in there too. So every single pregnancy product I've ever made is in the bundle. Or you can come join me in just the main class. That's $89. And you can use coupon code LUCKYDAY. That's LUCKYDAY. And that's going to give you 10% off just through tomorrow. So come use that coupon code and come join me. Was given the green light to induce labor. What are the best ways to do so? It's really up to your provider and what the hospital uses. It seems like every hospital kind of uses their own thing. Most hospitals, I think, use a medication called misoprostol or Cytotec. It's a little pill that they place every 3 to 4 hours to soften your cervix. And then once it gets softened, they switch to Pitocin. Yeah. And once your cervix is softened, Pitocin is really the only medication that you can take that will work. Do you throw up during early pregnancy? Often. I actually only threw up once in all 3 babies, so not everybody does. Is it true you can have a silent miscarriage? So it is true that you might not know that baby's heartbeat has stopped and you won't start bleeding, and then you go into the doctor's office and they might not find a heartbeat. That is true. Why am I talking about these horrible things? I wish I wasn't. Home remedies for headaches over on Facebook. I don't know. Talk with your provider though. They need to check to make sure your blood pressure is okay. Hospital, somebody's talking about how in Massachusetts they won't let her deliver in the tub. In some states, it's actually illegal for us to let you deliver in the tub. This is what I have heard. So talk with the hospital and talk with your provider, because some providers do not feel comfortable delivering you in the tub, because if something was to go wrong in the tub, it is very difficult to get you out of the tub and onto the bed. So you would need to be extremely low risk and no chances that your baby's real big. And then they can decide that. The hospital I last worked at, we did not let you deliver in the tub. Also for infection control issues, because it's a jetted tub. I'm not sure how we clean that. Yeah, so I don't know, but I know that we were getting you out of the tub to deliver on the bed. So oh, somebody said induce labor at home. There really is no way to induce labor at home. Everybody asks that one. My best advice is to chill out and just enjoy your last few days of pregnancy and try and manage the symptoms as you can, because a lot of the things people talk about just provide pain. Spicy food, jumping jacks, jumping on the trampoline. None of those are going to induce you. They're just going to make you hurt, which is very different than labor. Yeah. What advice do you have for first-time moms going into labor very soon? Well, Kayla, I would 100% recommend joining my prenatal class. A lot of people are like, oh, I don't have time. It's coming soon. But even if you just have a few hours, you can really get a lot done with my prenatal class. And all of my best advice is in there. Oh, so somebody's taking ginger chews for their nausea. I know I have heard some people doing the ginger something from Trader Joe's. There's like a ginger candy. I don't know. I didn't end up having that problem. So Lucy's talking about her HCG. I don't know much about HCG levels. I'm not. Somebody just asked. I don't know if they asked if I was pregnant, but I am not pregnant. My oldest is 24. If I'm pregnant, we will not be having lives because I'll be needing a lot. My placenta stuck and I bled a ton with my first birth. Will this happen again with my second baby? It can. It also cannot. A lot of it just depended on how the placenta grew. And yeah, so that varies for everybody. All right. I think I am caught up on questions. I'm going to give a last call for questions, especially if anybody has any questions about my prenatal class. I know it can feel like, oh, I'm just going to follow her online. I'll jump in on her lives. But you guys are just getting little bits and pieces about the labor thing. And then you're going to be in birth and you're going to wish that you knew the whole thing beginning to end, not just the bits and pieces that you've gotten from me online. So I think it can really help to know beginning to end. And that's what people regret not doing. So come join me. You can find it at online prenatal class or through the link in my profile. All right. I think we have all the questions answered. One final last call. Thank you guys so much for joining me. It's always fun to do these lives. I really enjoy doing them. And I'm glad that you guys were here and are interested in getting informed about your pregnancy. Somebody said, can I still eat a healthy snack after my water breaks at home? Of course you can. Some doctors are okay with you waiting at home for a while to see if you kick into labor. So it really depends. You want to call your provider after your water breaks just to get their opinion. Really depends on if you're GBS positive, any other issues, but call your provider, and sometimes they can let you stay at home. And if they tell you to go into the hospital and you would like to stay at home, say, hey, do you think I could stay at home for a little bit? And they may be like, sure, that's not a problem at all. But they didn't know that that was something that you were interested in, right? Because most people are like, I want to go to the hospital. I'm really nervous. So that's a tip for you guys. All right. Thanks for coming and joining me. Find my class under resources. You can also find lots of free resources under resources. You can find my induction checklist, my kick count cheat sheet, my birth plan series, my insider tip series. There's lots of great things that you guys can come and join me with. Taking Miralax after birth, I'm a fan of it. Yeah, anything that'll keep those stools soft. All right, I will see you guys in my prenatal class. Thanks for joining me. I hope you guys have a great night. Sure thing. Happy to take questions. And now.